Yes, 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 you are audible.
Good morning, Shital ma'am, and good morning to all of our
Good
participants.
morning.
Okay. Again, I welcome you for this webinar on adolescent nutrition hosted by the School of Sciences at Pimpri Chinchwad University. I'm Sanidhya Misal, Assistant Professor of Clinical Psychology. And before we delve into today's session, I would like to take a little moment to share about our Pimpri Chinchwad University and its driving force, PCET. Okay. Are you able to see this change in slide?
No, slide is not changing.
Okay, please give me a
It
moment.
is on the same
I'll
that.
just reshare. I feel
Yes, yes. Can you please?
yes. Thank you so much for your patience. So, talking about PCET, the Pimpri Chinchwad Education Trust, established in 1990, PCET boasts a rich legacy of nurturing excellence with a steadfast commitment to serving society, industry, and stakeholders through value based and quality education. With over 12 institutes and an impressive student body of over 47,000, PCET stands as a beacon of educational prowess. PCET's vision extends to the establishment of PCU, where our focus lies on delivering top notch education and fostering innovation. PCU offers a diverse array of programs such as engineering and technology, management, design, liberal arts, mass media, pharmacy, law, and of course the School of Sciences, which I'm honored to represent today. I would like to now share a short video that would showcase our beautiful campus. So please let me know if the audio of the video is.
The Pimpri Chinchwad Education Trust has established a state-private university known as Pimpri Chinchwad University at Sate, Vadgaon Mawar in Pune Metropolitan Regional Development Authority. It is a 30-acre campus of academic facilities and amenities for students and teachers to help them to achieve their fullest potential. The Pimpri Chinchwad University campus is well connected with the cities Pune and Pimpri Chinchwad by road through Mumbai-Pune National Highway number 4 as well as Mumbai-Pune Expressway. Also, railway station Kanhe is at 1 kilometer distance. The nearest airport is Pune Airport. PCU has its different verticals which prepares leaders from different fields. School of Engineering and Technology. School of Design. School of Media Arts and Communication Studies by incorporating cultural activities, events, and organized tours and trips, fostering a holistic development approach. In essence, Pimpri Chinchwad University is not just an institution. It is a vibrant ecosystem that nurtures talent, fosters creativity, and provides a platform for students to thrive in every aspect of their academic journey. PCU Bus Transport provides service across the city. Pimpri Chinchwad University, transformative education that empowers success in a rapidly evolving world.
Now, without further ado, I'd like to extend a warm invitation to our esteemed Head of Department, Professor Ruchu Kutiala, whose visionary leadership has brought the School of Sciences to fruition. Ma'am, please enlighten us about the School of Sciences and its endeavors.
Very good morning to all of you, and thank you so much, Professor Sanithya, for inviting me for the same. First of all, before I say, I would like to thank our speaker, Dr. Shital, for agreeing to deliver a session on a very, very important topic, which is definitely related to the adolescent healthcare. I believe the adolescent, the youth, they are the future of our nation, and their physical quotient and mental quotient, that is their health, if it is in good place, then our future and the I would like to say the vision of our Prime Minister Narendra Modi ji, it is also going to be possible, that is of the Viksit Bharat, because the youth is the future, and if their health is at place, then sky is the limit what we can achieve. Now, coming to the School of Sciences, I very proudly would like to say over here that we totally believe in sector specific and vocational enhancement kind of the programs. We totally believe that today it is the time that the youngsters not only they would like to explore more and more skills, but they would also like to be entrepreneurs, and they would like to be freelancers, and few of them would be working in the sector specific kind of the job oriented organizations. So here, if you can see, we offer BSc in nutrition and dietetics, not the home science, and the specific credits are allotted to nutrition, food science, public health, community nutrition, and dietetics, that is the patient care and the knowledge about the diseases. Similarly, we do not have applied or maybe general psychology. We totally concentrate on clinical psychology, because we want that the nation should be getting more and more psychologists, not just as a counselor, but also the one who can handle the people who are under stress, anxiety, so many mental illnesses and disorders. No wonder WHO data only says that, one in every seven individuals suffer from problems related to anxiety, and three out of the five individuals suffer from the problem called as the metabolic syndrome, where because of your lifestyle, you have to suffer a lot of diseases as well as disorder. It makes me very proud to say that recently now we have also come up with the more sector specific programs like BSc in clinical microbiology and also BSc in digital forensics. So we are trying to do our part again and again, and over here in the community. You all know PCET from almost 33 years old, and you know how much of the commitment PCT group has. But yes, with this PCU, that is a Pimpri Chinchwad University, university in itself means universe. We are trying to cater to more and more learners here in Maharashtra and outside the Maharashtra, because we do incorporate over here interdisciplinary as well as multidisciplinary kind of approach in our programs. And our all programs are aligned with National Education Policy 2020, which means more of inclusions rather than exclusions. So I guess with this kind of thought in mind, we will go forward. And once the session is done, I would also be talking about the eligibility criteria, how to become a nutritionist and dietitian, and also a clinical psychologist and clinical microbiologist. So I guess you all are waiting to hear to our speaker. So Sanidhya, over to you. You can introduce a speaker, or maybe Dr. Rupali can introduce. So over to both of you.
I'd like to invite Dr. Rupali, ma'am, to please introduce our today's speaker.
Yes, Sanidha ma'am, can you hold for 5 minutes? Actually, ma'am left the meeting.
Okay.
She had some connectivity issues, so we should wait 2 minutes. again she's joining.
No worries, Dr. Rupali. Technical issues can come. No worries.
Yes,
Till that time,
yes,
I
ma'am.
can just continue. That is fine.
Yes,
So
yes, ma'am,
the
please.
eligibility criteria, which I wanted to talk, I would be just percolating the message right now. Till that time, my speaker would also rejoin. So it's just that we prefer over here 12th science. So anybody who has pursued either physics, chemistry, biology, or physics, chemistry, math, they are very much eligible for our these four programs. But for clinical psychology, if you are also a humanities or art students or commerce student, but you have learned psychology in 11th as well as 12th, then you are very much eligible. So you must be wondering why we have kept one of the criteria as science, because you are going to deal with the human and the human minds. Your clientele would be not a machine or anything else. It would be tangible, that is called as human being. So, for that, it is very, very important that you understand the body well, very well. That is the anatomy as well as the physiology. And for that, if you are from science background, it is really going to help you to better adjust into the environment. We do also would be teaching you the languages like English as well as German and Japanese. That is our USP as well, so that not only in India, we want to see if you can, very well get connected for masters or maybe for the freelancing and job purpose abroad. So, this program, if you see, is not only concentrating on whether nutrition dietetics, whether clinical microbiology, clinical psychology, or digital forensics. We are not only talking about, if I have to say over here, just the majors of the subject itself, but also you are going to learn web designing, you are going to learn financial literacy. You are going to learn sales, conflict management. Because knowing about your own program is one thing, but at the same point of time, learning the allied, subjects also, which would be helping you to adjust better, maybe in your job, or maybe you start your own some kind of small sector. Now, coming to today's webinar, the reason behind of selecting this topic, that is the adolescent nutrition, we completely believe that nowadays, if we see lifestyle diseases and disorder, they are not only restricted to, adulthood. And plus, if we talk about the diseases and disorders, for example, heart diseases, problems in cholesterol level, or maybe pre-diabetic kind of stages, they all start with the how the environment is affecting you, what are your food choices for that matter, and how much is the literacy level in your family as well related to the healthy food choices. Maybe the sandwich which is posing to you very healthy, maybe it is not healthy in its true perspective. So, what are the eating habits you are developing own children from that grassroots level? If those are not very well in placed, then they become very much vulnerable for these kind of diseases like pre-diabetes or maybe problems in the blood cholesterol level at a very early stage, like young adulthood we call it. Somebody from a stage belonging to 25 years old or maybe 28 years old. I'm very sure you all would relate with me that nowadays heart attack, the age of the heart attack has also dropped to 26 to 27 or 28. So, why this is happening? This is all because of the environment, your choices, and your learned behavior. Learned behavior also stands over here, not only food choices, but physical activity, smoking, abusive of some ecstasy products like drugs, or maybe the alcohol abuse, which we also say as a substance abuse. So we very much are into the favor of this thing that good habits or the, the power to understand what is right and wrong, especially in terms of the lifestyle. This starts from a stage, whatever we say, as a stage of the adolescent itself, somebody belonging to the age of 14 to 18. Because once these habits are well placed, whether towards that side or this side, then it has been observed that good health, or maybe because of the bad choices, the effect on health can actually come to them later. So, with this kind of thought in mind, I request Dr. Rupali now to please introduce our speaker for today and let us
Okay.
take the session ahead.
Okay. Thank you so much, ma'am, for giving a brief full discussion about the health, which is very important from the adolescent point of view. So it should be very beneficial when we take care from the initial stages of life. So it is my honor to introduce our today's guest, Dr. Shital Nagre. Yes, ma'am. Good morning.
Morning,
Yes, Shital, ma'am.
Good morning, Rupali.
Okay. So, Dr. Shital Nagre is a dietitian at the State Health Department, and she's having a great experience over more than 16 years. So she had worked 10 years in the civil hospital, Thane, and 6-year experience in the mental health department. And she had also worked for the malnutrition, which is a major problem in India. She's also the part and parcel for the tackling the problems related to malnutrition in India. As a part of nutrition rehabilitation center, she's also as a leading program manager over there. She's also having involving in the certain disease management, which is very proudly we are seeing that is a non-communicable diseases which we found. So she's also dealing with this. She also spread the awareness between the relationship of nutrition and the mental health. So as we all of know, the not only the physical health but also the mental health is also too much important for dealing with the nutrition and healthcare. So she's dealing with this. She also has a Facebook page by Dr. Shital Chole. So to create the awareness for the nutrition in the society. So she's also actively participating there. She's also the have some separate corner in the Lokmat paper that is a very which we daily use. So in this paper, she had many more articles she had published, and very popular articles are there in the Marathi language. She also works for the society like tree plantation program, and also work with some NGOs for their educational and for their study material development. She also received many awards like Vrikshamitra, Samaj Bhushan, Ranaragini Award, Mother Teresa Nari Sanman Award, and also got the appreciation certificate from the Akshay Chaitanya for the great contribution for the building of Swastha Ahar program in the civil hospital. So as a dietitian, she is also involving the Food and Drug Administration, which is a central administrative program. So she is also invited as a speaker to conduct the program under Eat Right mission, which is run by the Government of India and created a huge awareness of millet in the school, colleges, and public places for Anganwadi Sevikas, and also dealing with the various government sector. She's also a very popular blog writer and the very popular articles in the Marathi as well as English newspapers. The Arogya Patrika and the food beverage magazines are also there. So in this also she had written many more articles there. So this is all about the briefing of Dr. Shital ma'am. So it's my proud feeling to introduce our today's guest. So I think Shital ma'am, can you continue?
Yes,
So
Rupali.
now, okay,
Hi, everyone. Good morning.
yes,
I'm Dr. Shital Nagre, working as a dietitian in State Health Department and having more than 16 years experience. And now today we are going to discuss about the adolescent health care and for that need of nutrition. Okay, next slide, please. So before understanding the adolescent need of nutrition, we must know the what is the adolescence. Adolescence can be a time of both disorientation and discovery. We might have noticed our teenagers always curious about the uh, opposite sex and the development, whatever may be the changes they are observing in their physical changes, or mentally they are sometimes they are confused with their changes, and we people should help them as a parent, as a teacher, as a professor. We are having the responsibility to use their energy in the right way. So they are always struggling for their identity, for their peer group. They are conscious about their health, their body look, and all those things. Also, they may use substance use, or maybe wrong things might they face. So we have to create awareness and use their energy in the right way. So for that sake, nutrition is very important. Please, next slide. So understanding the adolescent nutrition, we must know the stages of adolescence. The first stage is between age 10 to 15, second stage is 15 to 17, and third stage is from 18 to 24. In all these stages, there are different challenges they are facing. Like in 10 to 14 years, they are observing bodily changes, so they are curious about that changes. They might observe puberty hairs and all those changes. So we must educate them what is the reproductive health, what is the sexual life, and all those things we should make aware of them. So next slide, please. In 15 to 17 age, they develop mentally, they are become mature, and physically also they are mature. Now they are young adult, and how to carry them in the society is the challenge for them. So the purpose of adolescence is for a child to psychological and socially transform into young adult. Despite being thought of as a healthy stage of life, there is a significant death, illness, injury in the adolescent years. As we are watching since last 3 years, that Pune incidents, which which is the post car accident, we are watching that news that 17-year-old child was driving car in the speed of 200 kilometer per hour, and it is very dangerous to control these children and giving them the right education to impact right in the society. Next slide. So for the adolescent nutrition, we must focus on promoting mental health and well-being, improving access to nutritious and healthy food, promoting physical activity and active communities, improving healthcare and seeking behavior, promoting safe environment, reducing use and minimizing harm from substance abuse, promoting sexual and reproductive health. So we should understand the adolescent nutrition. We should promote their we should relate them how nutrition is related to their physical health and mental health. Next slide, please. Why we need to focus on adolescent nutrition? As we know, adolescence is a time during which poverty and inequality are passed on to the next generation through poor nutrition and health. So in the adolescent age, we should concentrate on good nutrition and inculcating the good food habits in the teenagers, so that they can be they can get adequate nutrition for their physical health, mental health, and so that the reproductive health. Next slide, please. There is relation between the diet and cognitive development. For good cognitive development, one should take good kind of foodstuffs. There is observation that, or there is a study which is showing that the inadequate nutrient intake might affect the cognitive development of the child. So one should take care of uh, nutrition of adolescents. Next slide. There is a table which is showing the summary of estimated average requirement for Indian population. So there we are seeing the various age groups in the table, which are showing their required body weight in that age. Also the consumption of how much should consume the energy, calories, how much should fat consumption should be there, protein and calcium and iron intake. So one should understand according to age group how much he should take the calories, how much fat he should take, how much protein, calcium and iron for not only the physical health but also the mental health. Next slide. This is the right time to inculcate good habits, like promote your children to take right choices for the food, uh, promote them for the outdoor physical activities, so that the we can get the good exertion for our mental and physics also. And also aware children or teenagers to not to use alcohol or the tobacco containing products to avoid the health problems. Next slide. Teenager and energy balance. Nowadays we are seeing that teenagers are watching social media, they are sitting at a place and not having the outdoor activities. So our overweight population and obese population is day by day increasing. So to control it, right kind of food, right kind of physical activity, outdoor game playing are the good solutions for the better health. Next slide. Teenagers and calcium. There is a huge requirement of calcium in this age as the structure development is going on of our body. So teenagers must try to take whole grains in their diet, vegetables and fruit, milk and milk products, nuts and seeds. Also pulses in their diet. Try to eat sprouts maximum time, so that they can get good kind of roughages, calcium, iron, and other nutrients. Next slide, please. Teenager and iron, as we are seeing in the uh, teenager girls, that they are many are of them are anemic because they restrict some food to take. They are more conscious about their figure, and they are not taking right choices of eating. So or many times it is happening that girls are not aware what kind of food should I take for the better nutrition. So we should make aware of better nutrition and iron sources. Which are the iron sources? We should tell them, like take green vegetables, sprouts in their diet, egg and meat products to improve the iron levels or hemoglobin. Next slide, please. Glycemia means the you should maintain the blood sugar well. So to do the activity, for the day long. Not only the physical activity, but also the mental activities also. We need glucose for the brain. Next slide. Eating breakfast. Breakfast is the right choice and it is the first meal of our day, and we should eat protein high protein diet in the morning. Try to take before meal. You should hydrate your body well. You should drink 2 to 3 glasses of water in the morning to hydrate your organs, so that you can make your body fresh. Then you should exercise well, so that your brain gets activated. You should get the right kind of energy for it. For getting right kind of energy, your first meal, that is the breakfast, you should take high protein breakfast, and and it should contain the various food groups like vegetables and fruits and pulses, cereals, etc. Next slide, please. Diet and IQ. As we know that brain contains 16% of fat. So many teenagers think that taking fat make them body fat. So they try to avoid fat, but let I aware you all that fat is required for the nutrient absorption also. So please take the essential fat requirement and good quality of fat in your diet, like you can take oily fish in your diet, you can take nuts and seeds to get good quality of fatty acids. Next slide, please. Fluid and hydration. Many times we confuse between the dehydration and the hunger. Many times we are thirsty, but we thought that we are hungry, and instead of taking hydration, we take the uh, we we take some meals. But it is wrong thing. Like just a minute 1 to 2% of dehydration may leads to headache, irritability, loss of concentration. This level is not enough to cause feeling of thirst. So we should understand when to hydrate our body. As I discussed before, in the morning we should take 1 or 2 glasses of water. In between meals, we should hydrate our body, and try to make that whatever liquid form we are taking, which is not sweet. Next slide, please. Diet and mood. Gut health and mental health is related with each other. So always you should mindful and conscious what you are taking in your diet. Many girls, teenager girls, they are taking black coffee and tea frequently, or they smoke to suppress their hunger. But it shouldn't be done, as it will lead to malnutrition. Next slide, please. There are also some food additives which are making us hyperactive. So we should avoid processed food. We should try to eat homemade foods only. Try to eat more and more fruits and vegetables. Try to take homemade food only. Whenever you are going out, you should carry a tiffin with you, or some roasted chana with you, or some carry a fruit with you, so that we can choose a right kind of food whenever we are outside also. Next slide, please. There are many eating disorders like anorexia nervosa and bulimia nervosa. These two conditions are seen in the teenagers, in which in anorexia nervosa, many teenagers trying to restrict food. They are trying to smoke whenever they feel hungry. They take tea and coffee. So they are leading themselves to malnutrition. So to avoid these things, we should know we should take whole grains, we should take complex carbohydrates to maintain our weight and maintain the glycemia. Next slide, please. It also affect our mental health. Anorexia nervosa, as we meet the malnutrition, then it affect our cognitive development and also the mental health. Next slide, please. Bulimia nervosa is the condition where the teenagers used to take huge plate of food, and then in short period they finish their eating, and after that they try to omit that food to maintain their weight, or they take some slimming pills, and they try to strenuous exercise to do to control their weight. So we should teach and guide them what kind of our food choices should be and what physical activities should be done for the right figure to maintain or right weight to maintain. Many teenagers feeling themselves like they have obese, but they are underweight. So it is also their misconcept. So we should make aware of them. Next slide, please. In this, as we discussed, bulimia nervosa, uncontrollable urges to eat vast amounts of food. They eat vast amount of food and they try to omit that food. But it is the wrong thing. Next slide. So for the better nutrition of the teenagers, and to make them sure that it should be adequate, as we discussed, EAR, estimated average requirement of nutrients, they must aware about that kind of food they should eat. More fruits and vegetables, pulses, whole grains they should take in their diet, so that their glycemia can be maintained. More milk and dairy also. Using fruits and vegetables, pulses and whole grains, they can uh, control their hunger and also maintain their body weight. More milk and dairy foods they should use to meet the calcium requirement, protein requirement. More iron rich foods should they take. More oily fish, like 140 gram per week oily fish should be taken in their diet. Less foods high in saturated fat, as we discussed, that processed food make make may trigger the brain and make us hyperactive. So controlling these things, and in future we may face the problems as discussed, Ruchu ma'am, that NCD problems are increasing day by day in our society. We are in our hospital also, number of patients of diabetes, hypertension, cancer patients, we are observing in our wards, and we are trying to control their situation, but it is the late uh, late to control. So uh, in the earlier stage only, the we should make them proper awareness, proper education for the nutrition to meet the adequate requirement of nutrients.
Hello.
Hello. So thank you
Yes.
all of you. I think I clear all the slides, but if you have any question.
Yes, ma'am. I hope I'm audible.
Yes.
So we've received a few questions actually through the chat box. One is asking how to promote healthy eating habits among adolescents, especially when they have hectic schedules and exposure to convenience foods.
Yes, we are knowing that teenagers having many uh, tensions of their studies nowadays. Also, they are handling social media and sitting at a place. So we should make sure that they should take fruits and vegetables or all kind of group of foods like nuts and seeds, egg and meat products, milk and milk products, nuts, seeds, pulses, cereals. All those things they should include in their diet. Also, physical activity is important to control the hunger. Uh, so whenever we do exercise, good kind of hormones releases in your brain, and it controls our hunger. So physical activity is also necessary, and time scheduling their meals is also important according to their daily activities.
Thank you, ma'am. Should we take another, ma'am? If
Yeah, so I first of all, before somebody else also asked the question, there is one thing which I definitely want Dr. Sheetal to talk about. Dr. Sheetal, you must have also seen in your practice, and even I have seen that parents have rooted this kind of a habit which is called as reward and award behavior whenever
Yes.
it comes to do some healthy eating. Like if you eat this bowl of, I can say, green leafy or maybe legumes, then you would be awarded or maybe reward in sense of, appreciation if you finish it off. So don't you think so that, offering a chocolate just because you finished a bowl of spinach, is this a good habit? Because then it becomes very
Definitely.
much rooted in them when they become adolescents. So I want you to a little talk about it.
Yes, nowadays we see that parents awarding them chocolates and many ready to use food which easily children get attracted towards it. So to control it, we must educate them what should be the right kind of food and what is the wrong impacts of processed food on our body, like extra use salts, it impact on our body. Then we observe that many products available in our uh, shops homemade uh, uh, protein bars as easily we can prepare laddus which we are traditionally made at home. So ask children to eat those and make choice of eating those in their diet. Like I always used to see children like or teenagers like eat uh, wraps, roti wraps, and all those things. So make sure that to prepare it at home and lesser from outside.
Yeah, thank you so much, Dr. Sheetal, for your inputs. And I guess we now, it's a high time we need to change our, certain learnings and we need to unlearn them, that whatever is in the plate, we say that you fit, rather than we should only take that much in your plate which you could be able to finish.
Yes.
So such kind of things which Annapurna we used to believe. So let us respect food in some other sense, especially on side.
Yes, definitely.
ma'am, one last question if we can take.
Yes.
About,
There's somebody who's
sports,
commented.
that if there is some
Yes,
special diet related to sports, right, Sanidhya?
yes, yes, yes. Any
So
particular
I was
recommendation,
thinking that
guidelines?
maybe we can invite Dr. Sheetal uh, to talk about sports in one of the, we can organize one separate session as a panel discussion with her related to athletes and sports,
Yes, definitely.
So, Piyush, your point is very well taken. So, we would be organizing a separate session and a panel, and then it would be definitely intimated to you because sports is a very, very big genre in itself. Like adolescent, similarly, sports performance, strength, and stamina. It is a separate topic. So, It's a very good idea. So on the demand, we would be organizing it in a separate session and we would be inviting you.
Yes.
But any other question from the audience side? Anybody else would like to ask any other question related to adolescent nutrition?
Good morning, ma'am. Uh, Dr. Anjubala here.
Yes, ma'am. Very good
Yes,
morning.
ma'am.
Yes, please.
Yeah,
Yes, please.
I would really like go with you that we should talk. We should invite Dr. Shital in personal session for our students of especially engineering and every student of university because they need this kind of suggestion. At times they don't get healthy eating habits by just saying their mother or something like that. If some expert is coming and telling them, it would be more appropriate and it would be well taken, according to me.
Yes,
So
yes. I totally agree with you. So, Dr. Sheetal, one more request for you, madam. I guess once our academic session is going to begin, which is going to be from 15th of July,
Yes.
and then we are also would be Dr. Rupali would be in touch with you, and she would be personally floating a invitation to you, and maybe during the induction session or so. We would
Yeah.
keep your session. So it's a request, kindly accept it at that time, and please honor us with your presence
ma'am,
at
one
that
more
time.
thing. I really don't know
Yes,
that is kind of related. Like there is some kind of relation between the food and your values can be like what kind of thoughts you get. If that kind of relation can be also put in that session, that would be really great. I really don't know that is expertise
right,
or
right.
not, which
No,
I
no, it
wanted
is
to say.
true that yes, yes, your family values, your environment really has a very big
No, the
role.
food which
So
we eat, that kind of values we get. That kind of like
correct, correct. Okay, so the relation of food with the mind. Okay.
yeah.
So there is a science behind it, but yes, we can definitely touch that topic at that time and we could definitely have a talk, although it is a little fad what we consider because food is always right for us in nutrition and rest all people are different, but still it's a thought which we would definitely be touching. Yes.
Oh,
So
thank you, ma'am.
so much. Sandhya, you can take if some other question is there.
Yes, somebody is want to talk. Somebody is there want to talk.
All right. I guess, Dr. Amruta, I would request you to kindly proceed with the vote of thanks. I guess we can't see any other question, so we can proceed.
Okay.
Over to you now.
Okay, ma'am. Good morning, everyone. It has been such an honor to be a part of such a wonderful webinar. On behalf of PCU and School of Sciences, I, Dr. Amruta Desai, take this opportunity to extend my heartfelt gratitude to our esteemed guest, Dr. Shital Nagre. Thank you so much, ma'am, for your time and energy. Sincere thanks to the entire Department of School of Sciences who handled the event throughout. A wide round of applause and thanks to all the participants who made this webinar a memorable one. Finally, I would like to thank all of you present here for making the time to be with us today and helping us make this event a grand success. Thank you, one and all.
Thank you so much for giving me such a nice opportunity.
Thank you, ma'am.
So thank you so much, Dr. Sheetal, once again. In no time, I guess, welcoming you in person and let the students hear you physically as well. So probably after a month or so. So thank you so much once again.
Thank you.
So here we conclude the meeting. So you all can now proceed with your daily chores. So thank you so much, one and all. Thank you.
Thank you, ma'am.